The Foundation for a Healthy Kentucky started 15 years ago with a mission to address the unmet healthcare needs of Kentuckians. Achieving that vision requires gathering and sharing the wisdom in Kentucky's diverse communities, nourishing that wisdom with training, funding, and credible research, and leveraging the greater capacity that results to promote policy that improves Kentucky's health.
When I was Attorney General, we started a lawsuit against the Anthem Insurance Company. We didn't expect it to prevail. We were very excited when it did prevail, well, at least to the extent of, to the tune of $45 million. And when we were able to get that $45 million into a foundation, I thought at the time that it could have a great impact on health policy in the Commonwealth of Kentucky and truly benefit the people from one end of the state to the other.
In that first year, we went out and talked to people in Kentucky. We did forums all around the state, and we asked people, you know, if you were king or queen for a day, what would you like to see us address? And it was interesting that people were very focused on youth, very focused on children, nutrition, physical exercise, so forth, on youth to stop the smoking and the substance abuse. And then there was that kind of global picture of what do we do about people that don't have access to care at all?
Dr. Bose was a former vice president of the University of Kentucky Medical Center for Health and for Policy and Program Planning. He was a nationally known health economist, and he counseled us from the very beginning. He said, you must focus on health policy.
Over the course of the 15 years since then, we have been able to invest $26 million in efforts to improve the health of Kentuckians, improve access to health care, eliminate or reduce health disparities, and better address equity or fairness around health issues in Kentucky.
And it's one thing to make a gut decision, oh, my community needs this or my community needs that. It's another to actually have the facts to use with policymakers.
So the Local Data for Local Action initiative was to get community buy-in. The Kentucky Health Facts was a great opportunity for the foundation to be able to pull all this county level data. So when you had individuals from Todd County or Christian County or Bath County, that they could pull their data down and see numbers that were related to their immediate community.
But we had to let the people develop their ideas, and as I said, the staff has been phenomenal in helping that, and the staff has been good at getting everybody together from the different projects periodically and sharing ideas.
The opportunity for our communities to have access for the investment of foundation funds will long outlive my tenure or the staff of Barren River District Health Department.
Probably the biggest leverage opportunity we had was we were able to secure one of the first grants from the Federal Social Innovation Fund. They put $3 million in our trust. We matched it $3 million. And then we went to community leaders and said, if you will match this again with your local dollars, and bingo, we had nearly $12 million in projects all over the state, demonstrating different ways to deliver care.
Investing in Kentucky's Future program is a program that takes school-aged children and works to make sure that they can avoid chronic illnesses that they may take into adulthood. And we know that's the place you have to start to make citizens healthy.
The foundation may be a bit of a pioneer in this aspect, in that their study of Kentucky's rollout of the Affordable Care Act isn't just a 2-year study after which you see a bunch of stuff on paper. It's an ongoing discussion, and data is looked at quarterly and analyzed, and it's talked about by the advisory committee for the foundation. It's made available to the public. It's made available to the legislature, so it becomes a kind of living discussion process.
We understand that training is a two-way street. There's wisdom, there's expertise all around Kentucky as well as around the nation that we can bring to bear. We have a series called Health for a Change. It's a series of workshops and webinars where we bring together, either electronically or in person, people who are working in health coalitions all over the state. The Boast Forum was named in honor of Howard Boast, one of our early board members. And within that Boast Forum, we bring in nationally known leaders and we lift up Kentucky work to share it, to talk about it, to spread it.
We found in our research a dearth of reliable reporting about health and health care. And we think we're moving the needle on that and getting more reporting and coverage at the local level.
So we've learned we want to work with broad-based community coalitions. We've learned that our efforts need to be multi-year. I mean, you don't just fund for a year, so you fund over a period of years. We've learned that planning is very, very important. So we need to spend a concerted amount of time around the planning effort and provide technical assistance to the local communities. We want the community to come up with some level of local resources to sort of emphasize skin in the game, that they are at the table, that they are invested. I think it's also important that we are providing for evaluation. How do we work with the local communities so at the end of the day they know whether they've had an impact?
The reason that Kentucky's kids are healthier today than they've ever been has a whole lot to do with not just the Foundation's resources, but the style in which the Foundation employs those resources.
Nothing has moved the needle on Kentucky's health as much in recent history as Medicaid expansion. And the Foundation has had a pivotal role in that because they've been evaluating the Medicaid expansion over the years and really putting their finger on what's working.
Actually, when the Foundation started, it was 0% covered by smoke-free laws, and now we're at a third, so that 1 out of 3 Kentuckians is covered by strong smoke-free laws.
The evidence is very clear that the integrated model really helps people move forward in healing. So it very much normalizes behavioral health as part of physical health and everything else we're doing that day.
We have many challenges right now in healthcare in Kentucky. We have the Medicaid expansion that's in jeopardy. We have a proposed Medicaid waiver plan to replace that. There are a lot of competing priorities right now. So as we move forward, Ben Chandler is going to be coming in as a new CEO.
If you have the chance to truly impact the health and welfare of your fellow citizens, I don't think there's any greater contribution than you can make.